That was a reaction from Pierre Prosper, the chairperson of the Seychelles Chagosian Committee. Elsewhere, Médecins Sans Frontières says it's treated more than 25,000 victims of sexual violence in the Democratic Republic of Congo. The medical charity says the figures are for the duration of 2023. It's the highest annual number recorded by the MSF for the DRC. The vast majority of victims were treated around Goma, a city in the country's east. The spike in incidents follows clashes between the M23 rebel group, the Congolese army and their respective allies. The BBC's Mercy Juma travelled to Goma and spoke to some of those affected. And a warning here, this report contains testimonies of sexual violence that may be triggering for some audiences.
Maria, not her real name, tells me many times she feels like her life is a terrible movie. I meet her at a camp for internally displaced people just outside Goma town. She has been raped twice. The first encounter left her with deep knife wounds and a pregnancy.
I was raped at my home. I ran here to the camp in search of safety, and I was raped again. Every time I think about it, I feel I have no value. I walk around very angry. I have little patience with people. So I come here to get help from the doctors. They give me breathing exercises. It helps.
According to MSF's new data, more than 2 people are sexually assaulted in DRC every hour. 90% of victims are from the province of North Kivu, where clashes between the M23 group, the Congolese army and their respective allies have been raging since late 2021, forcing hundreds of thousands of civilians to flee.
Women are treated as objects here. We can receive a woman 2 or 3 times a week. Each of these times, she is here for the same reason, being raped. They ask us, in our villages we were raped. We sought refuge here, we are being raped. We go out to fend for our children, we are raped. What do? We do not have answers for them.
At the end of 2023, the BBC visited health facilities in Goma, DRC. In one single day, we camped in 2 facilities and witnessed dozens of victims of rape coming in for medical help. MSF staff try to prioritize psychosocial support for them.
I've been in this facility for a couple of hours now. There's a lot of traffic in this shelter here. It's full of women and girls of different ages. And every time one of them stands up to go into the consultation room, her space is taken up by another woman. All of them are victims of rape.
According to the testimonies of patients, most were attacked at gunpoint, either at the camps or the neighboring hills and fields where they are forced to go to search for food and water. These women, though, are just a fraction of the survivors. Many others do not report or seek help, and those who do have devised a way of telling the healthcare providers what has happened without uttering a word.
To you, this is just a stone, but for the women here in Goma, this is very symbolic. There is a lot of stigma around rape and sexual abuse. Despite it being so rampant here, people don't just talk about it anymore. Now, when a woman walks into a health facility holding a stone like this, it is a non-verbal cue to the health providers here that the woman has been raped.
It is becoming increasingly difficult for health providers to cater for victims of sexual assault in DR Congo. There is limited supply of post-rape kits to care facilities and lack of legal support. There are also no shelters provided at all for survivors. This means for Maria and other affected women, the cycle of rape will likely continue. Mercy Juma, BBC News, Goma, DRC.
And still to come on Focus on Africa. Find out why these Nigerian